for having me back. I really appreciate that. I could talk about family stuff endlessly. So today we thought we would talk a little bit about a program that's available called Loved Ones Involved in a Network of Care, or we call it LINC, affectionately call it LINC. Give you just a snapshot of LINC and what we've been up to with it. And then I'll shamelessly plug at the end that if your organization is interested in bringing any type of family programming, LINC, or a continuum of services to your organization, I'd be happy to chat with you. So LINC, the goals of LINC is really to offer a bridge between inpatient and outpatient services. You know, this is such a critical time where we know a lot of gap happens. There's a lot of fall off for individuals who never make it to that initial outpatient appointment, which we'll talk about a bit more. And so the goal of LINC, bottom line, is really just engaging loved ones, however that's defined, while somebody is still inpatient, to help bridge that gap and encourage attendance to those initial outpatient appointments. So LINC offers supportive education and assistance with coordinating that care during that critical transition period. And it's ideally focused for individuals living with a bipolar illness, major depressive disorder, or a schizophrenia spectrum disorder, as well as their identified family and natural support. So it's this unique, it's a very short-term program. The goal of it is that it would launch into a longer-term family psychoeducation, 9-month to 2-year program. But this is just to give everyone sort of get everybody on the same page, hearing the same basic information, offering them some basic skills, and hopefully, prime their interest so that they would want to continue into a longer term program, which would also be available, at an organization as additional training. But it's a short-term family psychoed and engagement program based out of New York State that we've brought to Ohio years ago and have made some adjustments to make it fit for our state needs. But it's really providing that practical and immediate help when it's that point of crisis or point of discharge, and getting families ready for a loved one to return home and getting that individual ready to return home. The goals are, to assist in structuring sessions. So to help our providers really figure out, what could involving and engaging families in a structured kind of way look like without it turning into family therapy or crisis management. So it's something that looks and feels very different to what most families have had an opportunity to engage in. The goal is to really decrease rehospitalization rates and in return decreasing costs of care, because family is more informed. They're catching crises before they occur. They're ensuring individuals make it to outpatient appointments. They know the types of questions to be asking of providers. They know how to advocate. They really know what their role is, and most importantly, that they have a role to play other than being, a medication monitor or transportation to and from appointments. There's so much more that loved ones can be doing, without crossing that line of expecting them to do things that puts them in an uncomfortable sort of dual role. So helping them figure out what is that boundary for them, what do they feel comfortable and how much do they feel comfortable doing. And as I mentioned, the longer term goal is to get them to engage in 9 months to 2 years of services. So why LINC? So what we know is that nearly a quarter of individuals with schizophrenia specifically are returning to the hospital within 30 days for the same psychiatric reason after, that discharge. And that's a huge number of people. I hate that term revolving door, but this is where it comes from. A quarter of our folks coming right back to the hospital. But what we do know, and there's been, nearly 40 years of research that, when families are involved, the return to hospital rates decrease. So, when we have knowledgeable and supportive family members who know how to be supportive, and they know what information they need and they know what information they don't know, we see that it leads to reductions in relapse psychiatric symptoms, but also rehospitalization rates. And, other benefits of that, it improves overall family functioning and well-being, family relationships. People are getting back to work. They're getting back to, living their lives, engaging in social activities. So lots of benefits to having family really not just involved, but informed and involved in a very informed kind of way. We also know that those who attend an initial outpatient appointment following a psychiatric discharge are far less likely, really half as likely, to return to the hospital within the following year if they make it to that initial outpatient appointment. And they're more likely to be adherent to treatment recommendations, including but not limited to medication recommendations. And we know that families, loved ones, can really have a positive effect on attendance at outpatient appointment. Oftentimes if somebody is discharged from a hospitalization, they might return to the family home for a little while. And so, when we have these family members who are involved at this stage, helping them get to those initial outpatient appointments, it makes it less likely that they'll return to hospital. And families and natural supports really do serve as a protective factor for, treatment adherence, medication adherence. So it's mission critical that families and natural supports are knowledgeable about diagnosis, treatment recommendations, treatment planning, their role, expectations, all of those kinds of things. So I won't go through all of these, but the goal of LINC is really to engage them and to assist in that transition to outpatient appointment, help them understand that they have a role to play, make them feel better prepared for discharge, make them feel better prepared for those outpatient appointments, what to expect, decreasing anxieties about how do you talk to a medical provider, making sure that the family understands that they are an active part of the treatment team, providing a safe space before somebody is even discharged from the hospital to be reunited. And helping them with obviously that follow through. Some advantages, of LINC, because it starts in the hospital system, it has the opportunity to, branch our fingers out into multiple outpatient service centers or outpatient mental health agencies. So there's this opportunity to really bring our community organizations together and working together in a very structured, sort of formalized, coordinated way. There's the opportunity to bridge this gap that we've talked about between inpatient and outpatient by encouraging family involvement. There are opportunities to get creative, and I'll touch on this a bit more, but what is the role of the IOP? And it's something that we're doing with our current Cleveland partner, where IOP is viewed as sort of a step down from hospitalization, but then it's, they're receiving services 5 days a week. So it's a very steep drop off if they go back to treatment as usual and they only see, the provider every couple of weeks or every 3 weeks or every month. And so LINC can be, an additional step down from IOP as well, and engaging families from that point in IOP, having them be a part of that IOP process. And then obviously when they're discharged from IOP. Receiving direct referrals from inpatient providers, either psychiatrists, counselors, and, offering a continuum of services. So, LINC is the short-term family psychoeducation, but there are many, many things that could be done engaging with families, both on the inpatient and outpatient side. Other advantages, it's a wealth of data, I think, that really identifies areas for growth that we found. So who are those individuals who are struggling to make it to those outpatient appointments? Who are the people who register for LINC and then don't follow through? What are the characteristics? All things like that, where our goal is to really paint a nice picture of, what are continued gaps? What are things that we need to be doing more of? What are populations we need to target maybe a bit differently? LINC is a supplemental service in addition to treatment as usual. It's not meant to replace any service, and it is billable as a regular service. And, the training for LINC is really, palatable. It's really manageable. And then you have the opportunity to have ongoing consultation related to engagement of families. How do you work within family dynamics? How do you keep them engaged and keep them coming back? So quick snapshot of the criteria is currently we have one hospital system and one outpatient provider, as well as an IOP. And we are expanding to additional outpatient mental health agencies soon. So when you think of LINC, I always think of it in a funnel for those who are eligible. First, they have to say yes and agree and have an interest in participating. And they have to be meeting, diagnostic criteria and going to our outpatient providers who have a trained LINC clinician there. Co-occurring diagnoses are fine. And so, from all those who are on an inpatient unit, they have to be going to our outpatient partner. They have to meet diagnostic criteria. then they have to be able and willing to identify a support person that they'd like to engage. And then that support person has to be willing to participate. And so, you think you start with 60 people on an inpatient unit, that number can decrease. That's why it's important to have as many outpatient providers, as many hospital systems engaged as we can, so we can reach as many people as possible. Individuals are identified as meeting criteria when they're inpatient. If they are interested in participating, outreach to family is done. The natural supports are contacted, they're introduced to the program. Outpatient sessions are scheduled before they even leave the hospital. They attend 10-ish, there is no set number of sessions, but again, it's a shorter term intervention. And then we do quarterly reporting. We have, we've really become embedded in the hospital systems, flow sheets, data reporting. We receive these quarterly reports that looks at inpatient, outpatient, and the midpoint where they're in IOP or where their sessions are being coordinated. And then obviously we do some pre-post follow-up to gauge families' experience and individuals' experience. So this is just a snapshot of who's involved, from the inpatient to the outpatient side. IT is very, very important. And then as the Best Center consultant, I do that new training, ongoing consultation for at least a year, but we can do that beyond. We provide the materials, and we're really engaged with figuring out, the outcomes in the reporting piece, because that's a very important feedback loop. So that the hospital system and the outpatient providers know what is working, what's working well, what maybe needs tweaked. Just so you have it, I included a bit of information about what our materials look like. We do have an inpatient guidebook that inpatient social worker IOP staff use during that, we call it a transition meeting, but where family and individual come together before discharge, and it kind of prepares them for discharge in a different kind of way and sets them up to know what to expect in more detail for LINC on the outpatient side. And then we have a guidebook on the outpatient side that covers all different types of things. It looks at personal goals, family goals, problem solving, communication, relapse prevention, managing crises, avoiding crises. So we try to cover the gamut of things that families might be interested in learning more about. What are the treatment options? What are the diagnoses? Just to make sure everybody has at their fingertips in one place sort of a snapshot of expectations for when their loved one comes home, or as an individual living with a mental health condition. So obviously there are opportunities always for growth and expansion. So we've decided to expand LINC to include IOP as a step down between inpatient and outpatient, and folding LINC into that process. We're going to be incorporating additional outpatient partners. Something that's very important is making sure that everybody on an inpatient unit who meets criteria is offered the program, and that it's described in, a way that it's really inviting them into something new, something different. The same thing with their family members. And then talking with, individuals shortly after discharge to ensure that they actually all come to that outpatient appointment. And that's where that coordinator or liaison role becomes very, very important. So, our goal is obviously to continue to make this program or continuum of family services with LINC as a part of that available to other potential partners for inpatient or outpatient. So if you are, here's my shameless plug, interested in learning more, please, we would love to chat with you. I'd love to hear more about, your thoughts about what does family involvement look like at your organization, what's going well, what are areas that you want to consider maybe building out. We would be happy, and I would be happy to chat with anybody who is interested about LINC or any involvement of family in your organization, or sort of treatment as usual is really the goal, is that, loved ones are part of the treatment team as an expectation rather than an exception. That's where, the goal is to move in that direction more and more. So there is my information that you can reach out to me anytime. And receive training, consultation, even just to think through things in your organization with no commitment to, engage in any type of family programming with us. But I always love talking about, how things are going within your organization. So any questions, and obviously my references.